Hi, I'm Dr. David Hill, and today we're going to talk about infant eye infection symptoms. So, eye infection symptoms are usually pretty obvious in an infant. The eyes may turn red, there may be pus coming from one or both eyes, there may even be some swelling of the lids. Now, these infections can be very serious, and we need to talk about different age groups. In infants who are 3 weeks old or younger, these are newborns, there's a very high risk of having an acquired infection of the eye from the birth canal that could be chlamydia or gonorrhea. Gonorrhea is a very, very serious infection and can cause blindness. Chlamydia does not respond to topical antibiotics, that is, drops or ointment that you would put right in the eye. You need to treat it with oral antibiotics, something the baby would take by mouth. So if you think that your newborn might have an eye infection, you want to make sure that the doctor does a culture to look for chlamydia and also treats with an antibiotic that would cover gonorrhea. Fortunately, the antibiotics you put in the eye do that. Now, a lot of infants in this age group will also just have a blocked tear duct. That does not require antibiotic therapy, it just needs a little bit of massage. Usually the difference is that there's no redness of the eye, and what's coming out is more mucousy or watery instead of yellow and thick and nasty and what we call purulent, which is just looks like it's an infection. Now, for older infants who have eye drainage, we're still probably going to want to treat with an antibiotic, but it's not so important that we rule out diseases like chlamydia or gonorrhea. Those infections are usually with more common bacteria like Moraxella pneumococcus or Haemophilus influenza. Most importantly, if you're worried about your infant's eyes, if you see redness, if you see pus drainage, and absolutely if you see any swelling of the lids, do bring that infant to a medical provider to get a look-see and see what needs to be done. Talking about symptoms of eye infection in your infant, I'm Dr. David Hill.